Hi kids, great to see you, and thanks for tuning in. You know, I didn't expect you guys to remember me. I've been retired from full-time practice 13 years now, and the lovely remarks and comments from the various videos I put out moved me to tears, really. You're just too kind, and it makes me feel like a real imposter, which I am in a way. Because when I came to teen in 1972, I knew nothing. I knew nothing about general practice. After graduation, I'd done a couple of years in Canada, and to give you a clue of the kind of person I was, me and my wife had lived for 3 months in a tent. We were almost hippies. We came back, I did 6-month obstetrics in my hometown. And then we were short of money, and I'd been told how easy general practice was, so I arranged to do a locum in the Fen country. I thought it would be easy. Oh my God, I could not believe it. We were supposed to know everything. I was called once to a drowning, big long queue of cars, and one rookie GP driving to the front, and they all said, "Oh, it's okay, the doctor's here, he'll know what to do." Me. And then there was a guy who'd blown his leg off, in two anyway, with a compressor. And the paramedics were there, "Oh, it's okay, the doctor's here." What, me? Not only that, but all the other crazy things you had to know about. I decided that general practice was for the birds. It was the craziest job in the world. You had to know everything. So we went back to my parents' home, and I applied for a job in pathology. And while I was waiting for them to reply, I was drinking every night with me old friends, just for a couple of weeks. And then one day, one of the doctors I'd done my obstetrics with turned up and said there's a job going in teen, and he's quite desperate to get an assistant there. I'm sure he would consider you if you applied. I said, "No, thank you. General practice is crazy. I don't want to do general practice. I'm going to be a pathologist. I know what general practice is like." Well, my wife overheard this conversation. She said, "You will accept the job. We've got a 3-month-old baby, and I'm not going to spend 1 minute longer living with your mother than I have to. You will take the job." I did a Basil Fawlty and all. "Oh, yes, dear. Yes, dear. Okay." Because there's only 2 ways to win an argument with a woman, and neither of them work, as most of you know. So we came to teen, and on the back lawn, after multiple doses of gin, I signed on the dotted line with a heavy heart, seeing years and years of misery stretching ahead of me, trying to do a job which was totally impossible, and my heart was heavy, because nothing prepared me for general practice in my entire hospital experience. Let me give you an example. This is true, the Cannock-Harris syndrome on a Monday morning. When the patient comes in for a sick note with the words, "Doctor, I cannot carry on working with me back like this." Well, thinking, what the hell can this be? Drawing on all my hospital experience. I knew cancer could spread to the spine from prostate cancer maybe. I knew syphilis was a big mimic. Well, anyway, I did a very careful examination, including a very conscientious rectal examination. Well, the word quickly got around. "Don't go and see that fella shoveling for a sick note on a Monday morning. He sticks his finger up your backside." Forgive me for this, because it was a sign of conscientiousness. We were always taught if you don't put your finger in, you put your foot in it. And as Professor Harold Ellis says, "Practice rectal examination at every available opportunity. They are gold mines of information and impress the patients most wonderfully." So anyway, that was my extent of knowledge about back pain. Let me give you a rough scenario on how it would happen in those days. I was always working late, and my wife got fed up with it. She was threatening to apply for a single parent family grant unless I started arriving home early. And there was a 3-line whip for this particular night. And of course, your last patient, young housewife, wonderful, it might be a pill check, might be a blood pressure check. No, it's a backache. The involuntary gasp of dismay. Patients notice these things. So you can't do much about it. I'm in a rush. Cursory history, perfunctory examination. I told her it's lumbago and gave her some free samples of painkillers that the rep with the nice ankles had given me. And at least I'm home not too late that night. Well, of course, it doesn't work. The lady comes back next week, and now you've got more time. You do a more conscientious history, a more detailed examination, and you pull yourself up to your full medical height and say what you need is 3 weeks strict bed rest. Well, this is more polite than naff off, I've got better things to do, but let's face it, not a lot. The 3 weeks go by. Maybe she didn't obey your instructions, but maybe she found it a bit tricky, worried about the children starving to death, setting fire to the house. But now you are getting worried. So you write your best begging letter to the consultant orthopaedic surgeon with a special interest in backache. Who's not on a waiting list, by the way. Honestly, I remember this one was a year. And the only reason it was a year is because the computer didn't go longer than a year. So it's got to be a good begging letter. This wonderful, conscientious housewife, a part-time garage mechanic, a devoted mother, etc. You wax lyrical, trying to bend the rules and get her seen quickly, and putting in the PS, by the way, those patients I sent to you privately are doing very well, And maybe I do well. Maybe she's only got 3 months to wait. 3 months for her imagination to run wild. What could this be? This amazing backache. The doctor must be worried, doesn't know what's wrong. But the 3 months comes to an end, and she goes to outpatients with a little light reading, as it was then, maybe War and Peace, or the works of Marcel Proust. But it's going to be worth it, because she's going to see an orthopaedic surgeon with a special interest in backache, isn't she? You know damn well she isn't. The consultant orthopaedic surgeon with a special interest in backache is away at conference in Fiji, and she's seen by his research registrar who's researching something like, hip disease in field mice or something, and he's about as interested in backache as the rest of us. Not very interested. And he prescribes physiotherapy, which of course bombs. Then she hears about a retired furniture remover who's got what they call a good pair of hands and fixed Uncle Henry when he had a bad back, and she goes to see him, and who can blame her? And he puts his hands on her, there's an almighty crack, and he cures her. And he tells her that he's replaced a displaced vertebra that was pressing on her thymus gland, and she believes him, and who can blame her? Because he fixed her and we couldn't. Does anything make us look more stupid than back pain? So I resolved then and there that I would go on courses and learn all about back pain. There were other gaps in my armamentarium, millions of them. I wanted to learn about family planning, and I wanted to learn clinical hypnosis, because I thought that was so potentially useful in so many different ways. And I went away on as many courses as I could. But these are stories for another day. If you like this sharing of our history that we had from when I came to teen. Thanks again for listening. Let me know if you want more of this.